On this episode of the Ask Mike Reinold Show, we talk about stretching the shoulder into internal rotation with the behind the back towel stretch.
The Ask Mike Reinold Show. Helping people feel better, move better, and perform better.
Before we get to the podcast, I wanted to make sure you knew about my free online course on the Introduction to Performance Therapy and Training. If you want to learn how to get started optimizing and enhancing performance, this is the course for you. Head to mikereinold.com/performance to sign up today. Welcome back, everybody, to the latest episode of the Ask Mike Reinold Show. We're here up at Champion PT and Performance up in Boston, answering your questions. If you have a question you want us to answer on a future episode, please go to mikereinold.com, click on that podcast link, and we will do our best to get to each and every one of them. So let's see. We got Dave Tilley, Mike Scuduto, Dan Pope, Dewesh Podell, Kevin Coughlin, Lenny Macrina, and who do we have for students today, Len?
We have three students, three current students that we've had for a few weeks now. They've been really settled in over these last few weeks. We have Eric Deutsch from the New York Institute of Technology. He's sitting there in the front wearing his glasses. We have Cody Adams from Franklin Pierce University, great baseball program. I don't know about the Arizona campus one. Or Brian Hunter from the University of Hartford. Where'd you go to undergrad? I don't even know you're into undergrad. Hartford, I guess. University of Hartford.
Hartford. The double whammy. Love it. Yeah. Awesome. All right. What do we got for a question today, gentlemen? Back to Eric.
Yep. So stretching shoulder internal rotation with the behind the back stretch. Jim from New York, I loved your shoulder course and podcast. This is my first question. I see both physical and occupational therapists treating shoulders trying to regain internal rotation with the IR towel stretch behind the back. I've never been a fan of this and feel there are better ways to regain IR. What are your thoughts on trying to regain IR with the towel up the back stretch?
Yeah, I feel like you're ready to fight somebody right now, Eric. Is that the Long Island? Is that a Long Island thing?
I think so.
I love it. I mean, that's why this question from Jim from New York, I figured he's probably saying it with that same accent and stuff. So the two of you in a conversation would be amazing. So, all right. So behind the back towel stretch. Who wants to start on this one? I actually have some blog posts on this too that you can kind of Google around here, but that's certainly not a stretch that we do at Champion. I don't think anybody does it. If we saw somebody doing it, that would probably go poorly, but we'd have a little chat about that. But I get the concept of this, right? Functionally, a lot of patients, especially older patients and bigger surgical procedures, they complain functionally that they can't do activities behind their back. So gentlemen reaching in their back pocket sometimes, right? Going up the back in females is a common complaint that they talk about. They talk about how that's super awkward. So people, give them a towel and say, let's tug on it. Let's torque this thing. Who wants to start this one on? We'll just get right to it and say why we don't use it, right? Because I think that's an important thing to kind of talk about. Who wants to start? What's up, Dave?
I think this is a good example of a summary concept that we use a lot. And I learned from Mike and Lenny when I first started is you can have someone who is kind of like stiffness from a muscular point of view, but then has some laxity or looseness from a joint point of view. And I think oftentimes what we see in a lot of these patients in this joint and others is that sometimes when someone is lacking motion from a soft tissue point of view, they make up for that motion by maybe putting more stress on the joint capsule or maybe putting some extra stress on areas that maybe don't really like it too well. And this is a really good example, right? So like to get your hand behind your back, you need to get extension, but also IR of that motion. So sometimes we see people who have lacking IR from a soft tissue point of view or a stiffness point of view, but they're continuing to do the motion they want to get. And what happens is they make up that motion by putting some extra stress on the front of the shoulder. And you see someone when you look from the side, if they're doing this, they have a lot of like anterior glenohumeral migration, right? So they have a lot of forward motion of their shoulder, and it maybe feels uncomfortable in the front of their joint capsule, or maybe they're stressing a cuff tendon or a bursa or something. So sometimes it's a little bit better to break down that motion into pieces and figure out maybe which one of those components is not there that you're trying to find. Maybe the IR, right? Or maybe some T-spine extension someone's lacking to get that hand in the right position. So it might be a better option to check the pieces rather than just keep fixing the entire, motion as a whole.
Yeah, I think that's a great way of saying it. The body is going to take the path of least resistance, right? So if you're tight, I think one of our general concepts is if you are limited with your range of motion, we don't bring you to end range and then push it further, right? That seems weird, right? Like, so like, hey, you don't have overhead, flexion, just keep jamming it up until it goes. Like it's not like the way that we like to regain motion. So great point, Dave. I like that. Dan, what do you think?
I think sometimes this is kind of a clinical reasoning problem, right? One of the reasons why people can't get their hand behind their back is because it hurts to do so, and they're not necessarily super stiff per se. So you have docs that take a look at the range of motion, like, hey, you need to work on this, you need to push it. And this happens to me every once in a while. You'll have a patient that comes in, can't reach behind their back, and the doctor says, hey, you got to start working on this, and gives them basically the towel behind the back or something along those lines. When probably the reason why I can't do this is because it hurts so bad, right? So I don't know that trying to push into a provocative position is necessarily going to help. It may potentially, maybe you're arguing you're making that tissue adapt over the course of time, but I think the other piece is that it's not going to get you better if you keep on pushing through enough pain that it irritates it further, and it may affect other parts of rehab. So I think first and foremost, make sure they actually have a range of motion limitation. You're not just pushing into a provocative position because they're too fresh out from a given surgery,
Yeah, I really well said too. And if you break down behind the back, what I think is worse is when people say that shoulder has limited internal rotation, so I'm going to give them the behind the back stretch. I get it if functionally the person can't reach behind their back and you're trying to improve that. I get that. I still don't necessarily perform that stretch. But to say that that's an internal rotation stretch, to me, I think is a little misleading. So if you actually look at that, Dave alluded to this there, that is shoulder extension, adduction, and internal rotation. And it's kind of funny, like I broke this down in a blog post like many, many years ago. But if you actually look at that, the majority of internal rotation at the shoulder occurs like by the time you get to the sacrum. And that's not where people are tight, right? They're tight as they try to go up their back. So it's not even internal rotation. A good third of the motion is probably scapulothoracic anterior tilt and like kind of dumping, right? And the rest of the motion is shoulder extension and adduction, right? I think if anything, what this shows us isn't that we're bad at increasing internal rotation after a surgery. I think it probably shows us more than anything else that extension is the thing that we're bad at working on, right? We don't work on extension enough, maybe, or the surgical procedures that we tend to see, like a rotator cuff repair or an anterior capsule labral tear, those types of things, a capsular shift, they're all in the front. Those things all limit extension surgically, like they're designed to do that intentionally, right? So that's kind of like how it goes together in there. So to me, I don't know if it's even internal rotation that does that. There's other studies that have been published that there's a very low correlation between internal rotation measurements and your ability to reach your arm behind the back, right? So kind of keep that in mind with all those things. So I don't know. I mean, why don't I always like, we are answering the question, right? But I always like alternatives, right? So I think we should provide that in that episode. I think we've all said a good case as to why not. Who wants to jump in? Maybe we hear from somebody new. Like, what would you do different? What would you do different, Mike, to actually get that arm behind the back better?
Yeah, I would definitely, it starts with your assessment, trying to figure out if it's a capsular limitation or if there's a soft tissue component as well. Most likely, it's probably a combination of both. And we know that working on the posterior cuff can help improve internal rotation. So I'd probably do some pin and stretch to the posterior cuff, infraspinatus, even teres major. Can work on that a little bit as well. Working in the cross body motion, you can do a contract, relax, cross body stretch where you're stabilizing the scapula, stretching out the posterior cuff, and maybe getting a little bit of a capsular stretch, and that can help improve internal rotation. That would be my first kind of go-to from a soft tissue perspective. And then working on thoracic extension and scapular control exercises, I think could also help improve internal rotation.
Yeah, it's a great point too. And I think what from what I heard from Mike is like, let's look and see what's actually limited in that person. So if they're limited in adduction, horizontal adduction or adduction of the shoulder, then they're going to have a limitation in reaching up their back. But just work on the adduction, right? Don't just jam their hand up the back. Work on that one movement pattern, right? Work on thoracic position, work on scapular position, work on soft tissue before you just getting to end range of torque. Like I think that's a great way to do it. What
I
else?
think we
Anybody
got
else?
it. I think there's a time and a place too. Like you can't be doing this at 8 weeks out of a rotator cuff repair, right? I think you got to allow, because you said it. I think you said like why this is happening a lot in our shoulder patients is the tissue that was repaired gets stressed when you get into these positions. So I think, like we mentioned in previous episodes, you got to give this tissue at least 3 months to incorporate. Again, depending on the age of the person and the health of the person, at least 3 months to incorporate before you start thinking about, the behind the back, aggressive type position that they're trying to get to. If they are trying to do that and it's too early, I'd probably tell them to stop that, figure out a different way to live. If it's a female, the bra situation, putting a bra on, you try to figure a different way. Can you attach it in the front? Can you get a different style? Or just refer to my female therapist and give me some help. But I think there's other ways around it and not stress the tissue because you risk re-tearing it. So you got to be careful how you are when you're being putting these people in these positions to get that range of motion back.
Yeah, what's the number one thing we hear from cuff patients in terms of like how they think they injured their shoulder that put them over the edge? It's like it's reaching for your briefcase in the back seat of the car, and then like
pulling luggage or reaching in the back seat. That's a common thing, of course.
Yeah. What else, Dan? Did you have something too?
Yeah, I think Dave could probably speak to this as well, but I work with a lot of folks that are trying to get back to end range extension just because people are trying to do, let's say, like a bench press, but even more like a dip or ring muscle ups, that type of thing. You need a ton of extension for those things. So I don't feel like there's a whole lot of information out there on how to improve extension range of motion. So we do a bunch of drills. You treat it kind of similar to any other area where you're trying to gain range of motion. I think at least at the shoulder, you probably want to target the soft tissues in the front of the shoulder to help with extension range of motion. So maybe you're working a little on the delt, a little on the pec. Over the course of time, as they can handle it, you're doing some extension range of motion. Maybe start with something like a PVC pipe. Then I start doing some closed chain exercises, so like an assisted dip. I'll even do some dips slowly with a pause at the bottom. So we're working on slowly rebuilding that extension range of motion. But I think if you couple that with internal rotation, like you said, you're going to have a lot of success. You just have to slowly do it.
I think you nailed it there. And I think if we had to critically assess all of what we do, and even like all the protocols that we've written over the years, we don't talk about shoulder extension that much. We really don't. It's not included in a lot of those things. So that's probably an area we can improve on. Like I've started spending more and more time on that, like with my like capsule or labral repair type people, is kind of working behind their body a little bit, and just with passive range of motion, bringing them to end range and telling the tissue like, hey, this is the load that I want you to kind of feel here, some stress that I want you to get. And I think over time, my outcomes have gotten better to remove that like stiff period that sometimes a lot of them go through. So yeah, I think you're right. I think maybe focusing on some gentle extension range of motion versus waiting till 12 weeks and being like, oh man, it's tight. Grab this towel and torque the crap out of your shoulder behind your back, right? Like to me, like that just seems like the wrong approach. So awesome. All right. So great episode. Hopefully that kind of helps a little bit. Dig around on my website. I think I have, I do think I talk specifically about the behind the back stretch in one post, but I have lots of other things on how to increase internal rotation. And I think that is really what we tend to focus on more than anything else. So awesome. Great question. Thanks so much. If you have a question like that, head to MikeReinold.com, click on the podcast link, and you can fill out our form to ask us anything you want to talk about. We'll do our best to get to them. And please head to Apple Podcasts, Spotify, rate, review, subscribe. We'll see you on the next episode. Thanks again.